Welcome back. It's still the conversation, and we have a special guest here with us. Currently in Lagos State, we are experiencing a significant cholera outbreak, and the state has reported about 500 suspected cases as at today. Meanwhile, the Lagos State government has implemented various interventions to control the situation, leading to a reduction in cases in some areas. But the Lagos Island accounts for the highest number of cases. Meanwhile, residents have been advised to practice good hygiene, which means wash your hands, prepare your food in clean areas, and of course, watch what you drink as per water. Having this conversation with us today is the special advisor to Governor Babajide Sanwo-Olu on health, Dr. Kemi Ogunyemi. She's here to give us an update of the cholera outbreak in Lagos. You're welcome.
Thank you.
So what's the current status of the cholera outbreak right now in Lagos?
Okay, so it all started around the 9th, 10th, 11th, where we had an upsurge. And we reported, the first report we gave was 350 cases. Right now, just to let you know, we are having a case conference at 2 o'clock where you find the exact figures, diagrams, and a more in-depth update. But for right now, we have just over 550 cases. By 12 o'clock, we're going to get an update on the data, because continuously we're getting, when we get the reports, we put them in our system and then we know how many. So just to be accurate, I can just tell you that it's over 550 right now. However, sensitization is going around all over Lagos, day and night, even over the weekend, the marketplaces, the churches, the mosques, everywhere, to let people know preventive measures and what they need to do to prevent them from getting cholera.
Okay. I want a clarification with the 550 cases. Have they been confirmed to be cholera?
So there's a difference. So there's confirmed. Confirmed means we sent the stool specimen to the lab. So a lot of them are still waiting results. However, when people present with certain symptoms, you can assume that it is cholera. Okay. But you do also have to confirm.
Okay.
Yes.
So do we know the cause yet?
Yes, we do. So the ones we have tested, we found out that obviously cholera is waterborne. And I must add that cholera has never left Lagos. It's one of those endemic diseases that people get it, but it goes up during the rainy season, like now, where we are now. Okay. So it's not a new disease to the state or to the country at large. However, the samples have shown that it is cholera. Some of the specimens that we've analyzed, we've actually established that it's a cholera type. It's a subtype 01. And it is deadly, it is fast, it's contagious, obviously. And so we know exactly what we're dealing with.
Okay.
Yes.
Earlier during the weekend, there was also a report that tiger nut drink was the cause of it. Can you confirm that?
No, I can't confirm that it is, I can't confirm that it's tiger nut. So what happened was, when we first saw the surge in the numbers of people with cholera, there was a common denominator. About 10, 12 people actually said they had tiger nut drink. So, you know, when you go to the hospital, the doctor or the nurse will ask you, you're presenting complaints, what did you eat last? Especially when you come in complain of vomiting and diarrhea, what did you eat? Where did you drink water from? What do you think you ate that might have caused this? And that's why quite a few of them said they had tiger nuts. Hence hence we had to look into tiger nuts and get it tested. We should get results today. We've got samples of tiger nuts. So it's not that we're confirming that, oh yeah, tiger nut caused cholera. Tiger nut itself will not cause diarrhea, even if it's the cause. It's the water that is used. It's the way it's prepared. It's the people that prepare it. It's where it's been prepared. It's the environment it's been prepared in. So until we confirm that it is tiger nut, right now, it's not. It's just that people have said that's what they drank before they had the symptoms.
Okay. In terms of sensitization and awareness, and the report also shows that it is prevalent in Etiosa. is it Etiosa or Lagos Island?
Lagos Island.
Lagos Island.
So it started off with Lagos Island having the high. So there was all the, those local government areas. That's where we saw a lot of cases being reported. So it was Lagos Island, Kosofe, Etiosa, and then it went on and on like that. But right now I can tell you that all the local government areas have had one or two cases. So there's no local government that's been spared from it. But the numbers are going down. Gradually. So that upsurge is right up here where we're here. And we expected it to go up during the Elia festival because when people gather together, there's a lot of cooking of food. And if people use contaminated water, that's what happens. And we saw that. We saw the upsurge. And then we're now getting it coming downward. It's not gone up to where it was at the beginning when we alerted the public. Okay. So I can say that it is coming, it's coming down.
Okay, Abimbola has a question for you.
Yes.
You did say that cholera is one of those endemic diseases that never leave. So they're always here. It's always here with us. And of course, we just need to step up awareness. Can you also take us through other ministries or collaborating agencies that are with you on this? We do know this is not just an advocacy by the Ministry of Health. So please take us through other agencies that are working with you on this.
So absolutely, yes. And you know, we call it the One Health family.
Okay.
So we have the Ministry of Environment. They're key to this because it's an environmental issue as well. So we've been working hand in hand with them. And we've also been working with the Ministry of Education. They have a quality assurance network where they find out what's going on, and then they can alert the doctors, the teachers, and the students as well in terms of public health education. We're also working with agriculture because it's about food. And all the other agencies that actually feed into communities and the environment. Absolutely.
So, Guyami, I would just like to know, for those who are watching right now, what are those signs that would say or tell if somebody is battling with cholera, and what kind of engagement are you having at the grassroots to sensitize Lagosians? We all know that their sanitation and, of course, hygiene is quite poor at the grassroots level.
Thank you, Ajibola. So, yes, so signs and symptoms which we're telling the community is, the first thing is usually people complain of abdominal pain, and then you have watery diarrhea many times during the day, and then you have vomiting. What we found in our latest data is that all the patients, the people that are coming into the hospital right now are actually complaining of diarrhea and vomiting. So some people complain of diarrhea, no vomiting. Okay. But now what we're seeing is that they're having the vomiting as well. There's also muscle pain, because when you're vomiting and you're losing a lot of fluids, you're also losing a lot of electrolytes. So this affects your muscles, so people complain of muscle cramps. There may or may not be fever. Generalized malaise, just feeling tired. And of course, some people also have bloody stool, because it's in the small intestine, so they might complain of bloody stool. But the most common, the one that, you know, just come into the hospital, even if it's not cholera, at least you can rule that out, is watery diarrhea and vomiting.
Okay. Lagos State is a place where we're always having parties. It doesn't have to be during the festive seasons, and we have a lot of food vendors. What is the state government doing towards sensitizing them on how they handle food?
So I didn't answer. Sorry. I just realized I didn't answer the second part of Jibola's question, which is what are we doing in the community? And so, like I said, the environmental health officers, both at the primary healthcare level and, of course, at the Ministry of Health, are going around everywhere, basically, especially those areas that are hardest hit. They're going to the marketplaces, and we're telling people that this is with us, and this is what they need to do. Prevention is better than cure. We'd rather people not have it and do all the things they need to do, like hand washing and ensuring that the environment is clean, and covering, their food, washing fruits, rather than just pick it up and eat. But most important thing, washing your hands very well, and don't eat raw food. Some people like sushi, some people don't cook their foods properly, but you should cook your meals very well and ensure you can boil your water, cover it, and that's just basically it. We're going to the churches. Obviously, the schools are also, the teachers have been sensitized. Health agencies like the NMA, Nigerian Medical Association, the Nursing Associations, Medical Lab, they've also been sensitized, and everybody's going out there in the community and telling them what to do and what not to do. We've also provided chlorine tablets that you can put in 1 part to 100 parts of water that would clear and clean out the water. And in answering to your question about food handlers, they're key. They are key to this. So even in the schools, all the people around that area that sell all your mama puts and all the people, it's like you've got to wash your hands. We've got right into the marketplaces and the people carrying water in the cans, kegs. We've told them, even the men washing the raw meat, they use water to clean the area. Just ensure that the water is clean. Ensure that you're getting it from clean sources. And then one thing we've also noticed, and this is from the environment, is that we've noticed that some people they have their boreholes right beside their sewers. It is a no-no. There's actually law that says there's a certain distance it must be, and we found in going around that they're too close. It's just too close to where your source of water. So people have been encouraged to please move the boreholes and just general things like that, so that we can keep flies away into the water. And obviously, one of the most important things that I'm sure you've seen people do is defecating publicly. And so that is a problem. It's a big problem in Lagos, and we're working hard. The governor is working hard to ensure that for the environment, we actually give people good source of access to good water. And not only that, providing mobile toilets so that people don't have any excuse, because it's a rainy season. So just imagine, all you have to do is imagine it. Somebody has defecated by the roadside. There's bad rain like we had 2 days ago. It washes all that into an open system where wells that people still use, and boreholes. It can just go in there. And then, you've got environmental factors like climate change. There's flooding virtually everywhere. And I must also point out that the WHO has released that it's actually not only Nigeria. There's actually an increase in cholera around the world, absolutely. We're just, because we live here, that's where it concerns us. But there have been a lot, thousands of infected people across the world. So it's not just in Nigeria. I know some people say, why Nigeria? That we know this is going to happen, but no, it's actually one of those things, and WHO is taking them. Yes.
Yeah, Dr. Bunyami, just to stay on the grassroots awareness here, again, we do know that there are sanitation officers at the local government level. And so what would also be their role here, especially with what you've mentioned, where there's no proximity between where the water borehole has been sited and where the soakaways are? And perhaps are we also going to go a step further by prosecuting people in this particular situation? Because oftentimes you realize that when people are left off the hook, they take things for granted and put the lives of others in jeopardy. So what exactly would we be looking at here, talking about what the sanitation officers should also be stepping up on?
Yes, thank you. And they have stepped up, especially, I know it's because we have an outbreak, but it's continuously, so there's more emphasis on things like that. So they are going around, and people, there's a building code. So when people do not, we are going to ensure that sanctions are given to people who do not obey the simple building codes. So as they go around, they're noting the areas. Now, Lagos is densely and overpopulated. I mean, that is, to say the least, it is overpopulated. How many places can we go in a day or even in a week? So the best we can do is just ensure that during the time we're going around, we're making sure, they're making sure, and they're really working, rain or shine, because like you said, it's for everybody. It's for everybody. You may live somewhere where you have good water supply and all that, but then maybe your house help, somebody, your gardener, anybody that comes to your house to help you in your household may be coming from somewhere wherever the landlord has built the borehole near the sewer drainage. So they're going around and we're telling people and we're looking and we're telling them, move this, move that. So that's ongoing. That's a job on its own with the building code. But ensuring that when people are building, even moving along now, when people are building, they're building according to the code. Okay. And then, like I said, people, you know, the Ministry of Environment has been moving people away from areas where they shouldn't be building anything anyway. And, you know, we got some slack that, oh, we're just demolishing houses, but this is for the good of everybody. So we have to enforce the law. So if you don't have building permission, you shouldn't be building. Okay. If you're building and you're not building according to code, then you should stop, or your building will be brought down. But that's for environment, that's for building, that's for physical planning. So all those ministries come together to ensure that the rest of us are safe.
Okay. Ajibola?
Dr. Ogunyemi, I would like to know, are there specific programs targeted at our public primary and secondary schools? We all know that not all the schools have water, and these students and pupils, they will go out of their school compound to eat and to buy water. Then are we bringing back the culture of washing of hands in our schools?
Absolutely. So there's a WASH program. That's water, sanitation, and hygiene that's been going on, and we're pushing. And not only that, you know, on Thursdays, the market women have their environmental day. So I can tell you that that's coming back. It has to come back. We're working on, Ministry of Environment is working on that. So soon you're going to hear that we're sustaining that. And as for the schools, it's also, we've sensitized the teachers, the cleaners, the janitors, everywhere around there. And also, and the school system is actually doing that, Ministry of Basic Education, including Ministry of Tertiary, because the universities also have campuses where people are cooking and our students are buying the food. So there's a lot going out there in the community where people are standing there and talking to people and ensuring and making notes and taking samples of the water that they're using to ensure that it's actually safe. Okay. Yeah.
So, in the report I read last night, Lagos State is still expecting the cholera kits. No, the cholera vaccines. Yes. How effective will these vaccines be on the spread of this disease? Yes.
So the vaccine on its own is not 100%. Oh. It's not 100%. It's got to, you can't say, oh, I've had the vaccine and then you still have dirty habits. You're not washing your hands. You're not doing this. It goes together. So if you have the vaccine and you can still catch cholera by dirty habits, eating contaminated food and drinking contaminated water, you can still get it. But we do not have the vaccines right now. So it's good that we're pushing all the hand washing and environmental, sanitation and hygiene things. When the vaccine comes, yes, people who want to take the vaccine will take the vaccine. It's, as far as I know, it's effective when taken. It's in 2 doses. It's oral. It's not an injection, it's oral, and when taken, it can last between 1 to 2 years. I think it's 2 years. It's as effective as 2 years, which means after 2 years, you're no longer, you don't have that protection from the vaccine. But on its own is not enough. It works together with ensuring the environment is clean, you're washing your hands, and you're not drinking contaminated water, and your food is cooked well.
Okay. Abimbola?
Yeah, just to again say on the vaccine, we understand that no state in Nigeria has the vaccine yet. But then how will this work when eventually the vaccine comes in? Are we also expecting that this will form part of our vaccine what is it called now when you vaccinate children, immunization schedule for children, or will the vaccine be on the shelf, and if you want to get the vaccine, you're able to go to any health center and just get the vaccine?
Okay, so just for clarification, Ministry of Health, the primary healthcare agency, are the ones who request for. We don't make vaccines, like I said, so we have to ask from the people who make it. So I do not know how many is coming to Nigeria. I'm not the one that's going to distribute it. I don't know how many is coming to Lagos. I don't know the logistics around how the vaccines will be given to people. How many will Lagos get? How many will, you know, states in the north get? What will predetermine how many you get, when you're going to get it in the first place. So we're not focused on the vaccine. Like I said, it's your personal hygiene, environmental hygiene, sanitation, that's utmost important right now. And if you get that right, there's no reason, the vaccine will just be an added bonus. And then it's like most vaccines, I don't think it's going to be forced on anybody unless there are travel restrictions. Remember, there was a time we did have the vaccination, I think it was the yellow card that you have to have. Exactly, that was years ago. So unless that, it's not mandatory for people to get the vaccine.
Okay, so far, what has been your challenges, you know, in managing this outbreak?
I would say people not reporting early enough. This is a deadly disease, no matter how well you put it. Some people may just have diarrhea, and then they kind of like treat themselves at home and they're fine. But some people may have diarrhea, the vomiting will come later, they have a fever, and then they don't report. So what's been challenging for me, and probably painful, and I really commiserate with those who have lost loved ones, is that the earlier you come to the hospital, the higher the chances that you're going to survive it. It's curable. It's not a disease that you have and then you have it for life. For that moment, it's curable. But if you do not come to the hospital on time, there's little or nothing we can do. So some of the patients that have actually died have been brought in dead. So it's not that they came in early, but now we're seeing, I have to say, we're seeing more people coming in early, they're treated, some of them go home, some are admitted, some have to have dialysis because it's affected their kidneys. Yes, that's how bad it is. Some people have been on dialysis because of the dehydration that has affected their kidneys, the kidney shutting down. So that's been a challenge for me. Another challenge is when people are complacent and they don't really, I think it was just like COVID as well, where people refuse to wear masks, and so the same old thing continues. We're cleaning gutters and canals, and people are still flooding it with trash, and so that can be frustrating. But I know, you know, this is Lagos, overpopulated. Everybody wants to come to Lagos, and there's nothing we can do about it. But it does put a strain on our health services as well. But so far, I mean, we're up to the task. We've got the right people in the right places. Lagos always leads. In terms of absolutely, this is Lagos indeed, and so we're trying our best. Okay. That's what we're doing.
Right. So can for anybody presenting or who presents with some of the symptoms you've mentioned here, and they decide to, you know, administer first aid, is that allowed? And if they are administering first aid, what exactly are they doing?
Oh, you mean at home?
At home,
they have
before coming to the hospital.
Yeah, they're probably one of the number one thing. The very first aid is rehydration, because remember I said you have diarrhea, you have vomiting, you're losing a lot of fluids, and your body needs the water, and that's a problem. But so we tell people oral rehydration therapy, even in the schools and all that. So some people, I mean, you have clean water, bottled water, a teaspoon of salt, a teaspoon of sugar, and you take it to your body to replenish some of the lost fluids, electrolytes that you've lost. However, you do that at home, but still come to the hospital, because if you're vomiting, the chances are that you can't even take oral the oral liquid, so you need IVs.
But we have those who still, some people who still go to the local chemist, you know, to get antibiotics, and you know, when they take them, they're okay.
Yeah, well, I wouldn't, no. I would not advocate, and that's one of the things we're saying as well. It's not just about the environment and hand washing. It's like, if you have these symptoms, please come to the hospital. Do not go to the pharmacist or the chemist. We've told the pharmacist, do not give antibiotics to people, because what it's done as well is that it's affected our samples. So when you start antibiotics, and you come to the hospital, it's difficult for us to know what antibiotics are sensitive to, what you have, or resistant, because it won't even give us a clear picture. So we're just saying, take the fluids and bring yourself to the hospital. And it's free. I've got to say this, it is free. So a lot of people don't come to the hospital because they feel they have to pay to see the doctor, they have to pay for the car, they have to pay for the antibiotics. But any public health issue like this is actually free. They don't have to pay anything.
Okay. Earlier, Abimbola mentioned some collaboration with other agencies, and particularly about Lagos State Environmental Protection Agency. What exactly are they doing in the situation?
Oh, they're doing quite a lot, actually. So they're going around with the environmental health officers, and they're communicating what they find. So when we go to an area, that we're testing the waters as well. We should get some results back, and basically they're also sensitizing. They're also providing clean, good water to areas where it's suspected that the water source is not good enough. So we just close it off, but then we also provide water for that area. So they're very active. They're actually working pretty hard with us, and they're giving us the data. And they're reporting areas. The other day we had an area where I think there was a lot of trash. Before we knew, we called Loma, please clear it, and they did so. Within hours, the whole place was clean. And so that's what we're doing all around the local governments. Obviously, where they have only like one case, will be one of the last local governments. So we're focused on the ones that are reporting more cases.
Okay.
Yes.
We'll go on a short break now. When we come back, this conversation continues.
I took the bus from Tinubu side, and on my way to Idumota, I just realized that this guy was really trailing me. I, look over my shoulder, it was still there, but so something just said I should I was wearing trousers with zip. So when I checked my trousers, I realized that it has been unzipped. Then I put my hand in the pocket, and the money there was just gone. So I suspected him, so I just got down from the vehicle, ran after him. He knew I was really after him. So he quickly gave me my money back.
Welcome back. It's still the conversation, and we have Dr. Kemi Ogunyemi here with us. That was a Lagos resident who shared his experience here in Lagos. You know, in Lagos, you have to be wise, you have to be sharp. Do you have any experience, you know, about Lagos, whether good or bad?
Let me think of the stressful part of it before I got I'll tell you the good parts before I even got a driver. So I moved back to Nigeria 10, 11 years ago, and driving on the streets of Lagos, oh my goodness. It's like, what? Patients, they bring out, like, you know, you're angry behind the wheel and you have to calm yourself down, and it's like, okay. They cross, especially the downfall drivers and the Okadas. It's like, oh my gosh, I nearly hit him, you know, and I knew I had to get a driver, and even I'm one of those back seat drivers as well. So, you know, you're looking at the driver and you say, watch his face, watch out, whoa, you know, that kind of thing. So that kind of like hit me, and it's still ongoing. It has not changed one bit. Those who go on one-way streets, and you know, and you're having to stop for them and move for them. So you're doing this defensive driving basically every day. I call it defensive driving. So I've told my driver that he has to go for defensive driving. You can't driving. You cannot be fighting these people because you know what happens. Everybody, I always say, everybody has a PhD in sorry. As soon as they hit you, they don't have any money. And then one of my friends who an Okada came right in front of her, she hits the Okada's back tires, and the guy was fine, but he sat there and everybody surrounded her. All the Okada community. They came, and she said if not for a LASMA person that saved her, she knows they would have lynched or broken her, because she was driving too. So that's kind of like hard, but what's good? I mean, what's not? It's
what's not good about Lagos?
Not good about Lagos in terms of, you know, when you've lived abroad, and you can't really call living abroad home. This is home. So, you know, and Lagos is the heartbeat of Nigeria. Absolutely. You get to that airport, no AC, no nothing. Yes, I'm back. Yes, you're excited to leave. So you go on your vacation. You're so excited that, oh yeah, I'm going to America, I'm going to England, I'm going to Dubai, or whatever. And then after about 2 weeks, you know, you're looking forward to going home. You're just like, yeah. Not that we travel a lot now because of the price. Gone are those days where, you know, the holidays you go. But by and large, you know, the system, you're Nigerians, you're Lagosian, and I'm a Lagosian, and, you know, you're here. The weather is fantastic, you know, in terms of instead of the cold, snow, or anything like that. And then just the people, and I'm a people's person, so I love people. And I talk to people, so I like Lagos. Okay. After Lagos is Abuja. Abuja is calmer.
Okay. But there's nowhere like Lagos.
But there's nowhere like Lagos. You want to come to Lagos and feel it. But yes, it's good.
Okay, let's go back to our discussion for today. I want to talk about the support system, you know, for families, you know, that have been affected by the cholera outbreak. You know, what is the Lagos State Ministry of Health doing for them?
We give them the free care.
Oh.
It's free care. I mean, for those who have cholera, so they go home. We don't have a system right now where if you've been treated with cholera, then there's somebody calling and finding out how you are. I mean, it's so, like I said, just too many people. We're short-staffed. Even with all the things we're doing in the environment, we mustn't lose sight of the fact that we are really short-staffed, and you know, we keep on employing the right people, not just anybody. So that's support when we tell them to come back for follow-up. And that's where you give them support. For the elderly and who we have ECOSHA. So, you know, we have the Lagos State Health Insurance, and this is a good time to bring this up, in that we're encouraging people to take Ilere Eco. Ilere Eco is the Lagos State Health Insurance scheme, and And sometimes I'm surprised where people come to hospital and, you know, they charge 20,000, 30,000, they pay it. But do you know that Ilera Eco is 8,500 and it's for the year? So we're encouraging, that's another thing we're campaigning about, that
Just
they need to...
8.5 for the year?
Yes, for the year. Pregnant women get free antenatal care, which started late last year and it continues. But EcoSha is for the vulnerable. It's for the people who can't afford. Obviously, there's a criteria that LASHMA, the agency that is in charge of it, they will look at. So we're encouraging people to please just register and enroll for health insurance, and because a lot of people are worried about paying hospital bills. I don't know if you know about the Alafia Eco that's under Eco Cares.
Okay, yes.
The second part of that is coming soon. We had to postpone it because of the cholera outbreak, because we felt that if we did it, that's where everybody with cholera will come to, and that's not doing anybody any good, because we don't want our healthcare workers and even other people to. So when this dies down, hopefully soon, completely, then we'll have the second phase. But we had over 15,000 people get free health check, free drugs for 1 month. That's quite a lot. So the governor, kudos to the governor for approving that and spending all that money. But yes, so those are the kind of supports we can give the family members at this time.
Okay. Abimbola has a question.
Okay, so I'd like to ask, I know that we have our own, of course, at the NCDC at the moment. So what kind of support are you getting from the NCDC? And also 767-112 are the emergency numbers to call in Lagos. Are there other numbers that Lagos resident can also reach the Ministry of Health or complain if they have issues around cholera outbreak?
So NCDC is doing, obviously, that's the national agency, and they're doing a lot. So they provided us with RDTs, that's rapid diagnostic test kits. Which doesn't take the place of the lab test. This is just so that we know immediately they come in. So all the general hospitals, primary health care, comprehensive centers, LASU, they all have them. So they give us 1,000. And there'll be more to come. We've also got supplies from, and it's not just NCDC. We all have other partners as well. We have UNICEF, we have WHO, MSF, Red Cross. So we've got PPEs, personal protection equipment, that they've given us. We've got IV fluids that patients need, which helps a lot. Don't forget, this is free to the patients. So we've got all those that are, that's how they're supporting us. And of course, they're looking at our data to determine if we've got to a threshold of being, of it being an emergency, but so far, so good. So they're keeping an eye, so we look to them for, obviously, advice. They're supporting us, they're on ground. They do all the risk assessment, like I said earlier. So that's been pretty good. We wouldn't have done that without all those partners supporting us.
And the numbers?
Yeah, the same numbers. Lasambos is there, 767, yeah. They're still there. We've had people call and they give advice as well, what to do. And it's usually, if they have, it's come to the hospital. Okay. It's just come to the hospital. There's no, oh, stay at home, drink water. No.
I'll go and buy antibiotics.
I'll go and buy antibiotics. Absolutely not. You're not going to get that. And yeah, that's still the same number.
Thank you very much. You've heard
welcome.
it all. You've heard it all from Dr. Kemi Ogunyemi. She's a special advisor to Governor Babajide Sanwo-Olu on health, and she has come to talk about the current status of a cholera outbreak here in Lagos. Thank you for coming.
Thank you very much.
The program continues after this short break.